But not every situation requires an emergency room visit. We're talking about a smarter, faster way to get the care you need exactly when you need it. My Cardiologist Now is redefining access to cardiovascular care with a walk-in model designed for urgent, non-threatening symptoms, offering same-day answers, advanced testing, and real peace of mind. Dr. Yael Samoli from Cardiologist Now, My Cardiologist Now, is a trusted expert in the field, board certified as both a cardiologist and a nuclear cardiology with a strong focus on prevention and patient care centered. Thank you so much for joining me today.
Thank you, Farah. Thank you.
It's really a pleasure because you are with My Cardiology, which is another group, and it's the same group, and now you're offering My Cardiologist Now. And these two modalities, these two practices really blend well from what the community needs. And let's talk about what My Cardiologist Now does and how is it different from traditional cardiology office?
Well, we have a new facility, a new concept in delivering cardiology care. This is same day, no appointment necessary, walk-in cardiology care. Now, you know, when you want to make an appointment to see a cardiologist, could be weeks, could be a couple of months, and by the time you get to see the cardiologist, whatever was going to happen happened already. So we are changing that paradigm. This is a shift now. So if you need cardiology care, you can get it on the same day, walk-in clinic, walk-in facility.
And you're located in East Kendall right now in the Greenery Mall. Talk to me a little bit about what you see on a daily basis at the My Cardiologist Now facility versus the traditional one that you have with different locations throughout our area.
Well, you know, patients don't always pay attention to their own symptoms. Your body gives you a warning when you start having some chest discomforts or shortness of breath, maybe some palpitations. You should pay attention to that and seek medical advice just to be sure that it's nothing more serious. You know, I have a number of patients who say, I have high blood pressure, but I didn't feel anything, so I really didn't check it. Sometimes the first symptom is you have a stroke. We don't want to wait for that. So people need to take care. Take care. And in our facility, we care. We care to find out in a timely fashion, because you know, if you want to get a cardiology consult, it could take weeks, maybe months, and that may be too late. Now, of course, if you have severe chest pain that just started, shortness of breath, and you're breaking out in a sweat, an outpatient facility is not for you. You should consider going to the emergency room for that. But if you've had questionable chest pain or heaviness in your chest, tightness, or something in your arm or your neck, and it's been going on for a couple of weeks, or shortness of breath, low energy, blood pressure too high, then this is the perfect facility for you. We can evaluate you all in one day, do all the evaluations, make the diagnosis, initiate the treatment, and take care of you.
Talk a little bit about some of the testing that you do on site at the My Cardiologist Now facility.
Well, it's a full facility. So we have electrocardiograms, echocardiograms, ultrasounds of the heart, ultrasounds of the carotid arteries. We can do stress testing, Holter, 24-hour Holter monitors. But what's really fascinating is we have at this facility a CT angiogram machine. It's a non-invasive CAT scan where we can see inside the arteries to see how many plaques you have and if there are any significant blockages. So we will know right away if any of this is it heartburn, is it this chest wall pain, or is it coming from the heart pain? We could tell immediately if this is coming from the heart or it's coming from something else, because you want to know that.
And again, if there is really a true emergency, you shouldn't wait. You should really go to the hospital or call 911.
Right. If you have acute onset of chest pain, you don't know what it is, and it's really troublesome, I would recommend seeking emergency care. But people are smart enough to know which is emergency and which is something that's been going on for a couple of weeks or a couple of months.
Do the symptoms from men to women vary? Are they crossover? What a heart issue might present for a woman be different than with a man?
And oftentimes very different. Remember, people hear the usual and customary. I have pain in my heart and down my arm. But there's no heart in your arm, okay? It's a referred pain. And women oftentimes have a little discomfort, maybe some neck pain, maybe fatigue, some shortness of breath. You know, the heart doesn't read the textbook. So it's sometimes quite different. There's not very many symptoms, and you may just have fatigue or shortness of breath. So these things need to be looked at, especially if you're not feeling yourself.
Why is there a need for a walk-in cardiology clinic?
Well, what happens is if people say they're going to get a cardiology consult, and as I mentioned, it could take weeks, months, or they're going to go to an urgent care center. You walk in an urgent care center, sit next to all the people with the sniffles and the COVID, and it's not funny. It's sad. But they want to get evaluated, and then you know that the urgent care centers, 95% of them are all owned by the hospitals. So what does the urgent care center do? They shuffle you off to the emergency room. In the emergency room, there you are sitting on a gurney for 4 or 5 hours.
If you're lucky.
If you're lucky. And they do the tests that they need to do, and maybe a few extras. But by the time when you do get the bill from the hospital, it'll give enough to give you a heart attack. Because you know how expensive hospitals are. Yeah, and we don't run like that. You know, we take insurance. We charge the appropriate, usual and customary fees, not the cranked up, puffed up fees that hospitals can sometimes surprise you with.
And with insurance, what does a visit to my cardiologist now cost?
Oh, I don't know the exact numbers, but I think
it's going to be a lot less than going to a facility.
I think that a consult is somewhere between $200 and $300, you know, for the time that's spent. But our cardiologists are trained to actually sit down and listen to you, listen to what your symptoms are, order the appropriate testing, look to find the answers for you in a very timely fashion.
How many doctors are with the My Cardiologist now?
Well, we now have 25 cardiologists.
That's in the whole practice?
In the whole practice. And our cardiologists are handpicked. All are board certified. They're all top in their classes. They come from great programs. So you're not getting mediocre care. So this is the shift. This is the paradigm shift. This is the novel change, is you're getting top-notch, top-quality cardiology care in a walk-in setting, same day appointment. And we have all the equipment there at not hospital prices.
It's wonderful to hear that because the cost of healthcare is booming. That's for another show between us, right?
Yeah, you know, medical care has changed so much since when I first went into practice. You know, in those days, we held patients' hands, we listened, we heard all the problems, we did what we could. Today, it's, you know, in and out, in and out, in and out. It's terrible.
What is that like for you to see, coming from when you first started to now where you are in your career as a medical doctor? What is the shift that patients need now versus then, and what they're might not be getting now in other facilities? What are you hearing?
Well, yeah, I do hear, like, patients, they go to their gastroenterologist, they get a colonoscopy because they have pain, and it's normal, and they shuffle them out the door. But he said, well, what happened to my pain? Oh, go back to your primary. Maybe I'll order a CAT scan of your abdomen. You see, it's become a business for some people. And that's very sad, okay? And you need to treat the whole patient, not just the test, not just your favorite test.
And if someone is having stress, could that bring on symptoms for a heart condition or?
Oh, yes. That's clearly a risk factor. You know, first, it secretes all these cortisols and steroids, which increases buildup of plaque and cholesterol. And there's even a syndrome that stress-induced cardiomyopathies, where you can have spasm of your arteries and cause a heart attack. Okay, but I'm happy to say. And when you do the cardiac catheterization, their arteries are normal, and yet they had this big heart attack. Fortunately, in most cases, after 6 weeks, the tissue didn't die and it comes back. But, we see a number of those each year. So stress is clearly a factor. Stress also will raise your blood pressure. And elevated blood pressure is like taking a hammer and whacking your arteries. So you've got to get your blood pressure under control.
And how do you do that? Let's talk about some of the things that we could do and not have to end up in my cardiologist now, only for like a yearly visit.
We're preventing heart attacks. We're preventing strokes. And that's what we're talking about.
Right.
Treating a heart attack is
we know
what the emergency room.
What you need. Then we're in your hands. But what can we do? And then the audience that might be watching today, what can we do to prevent further things? Could it be diet? Could it be sleep and rest? Special vitamins, let's say?
All of the above, and then some, okay? Diet and exercise will avert the evil decree. That's right. But sometimes diet and exercise is not enough. And we have to be careful to choose the right parents, because heredity is important. Genetics is important.
So, in other words, if your mother or father had a heart attack, chances are that you could also have coronary disease.
If they're diabetic, or if they have high blood pressure, or if they're anxious people and you become an anxious person. So all these things.
Do you know me?
So all these things need to be controlled. Okay, so if your blood pressure is not controlled, you control it. If your cholesterol is too high, you bring it down. Yes, you could start with diet and exercise and see if you can do it and with a sustainable diet that you can adhere to. And if it's still elevated, then we treat that cholesterol, because we know cholesterol elevation will contribute to blockages in your coronary arteries, carotid arteries, renal arteries. So that's important.
Are we talking about cholesterol if it's too high, but all the other numbers are in good shape? Is that recommendation for a statin, or is it people that are both the good and the bad, or and the ugly?
Yeah, that's right. The good, the bad, and the ugly. The clinical studies have shown that LDL, low-density lipoprotein, or as I refer to it, lousy density lipoprotein, is the primary target. And clinical studies have shown that should be our focus. And of course, we can subclassify and subfractionate cholesterol particles to see if they're little guys, big guys, small guys. But if the LDL is the primary target, HDL is helpful, but only to a point. Triglycerides are important. If they're over 150, we have to take notice and address those as well.
Talk about a kind of diet or lifestyle change one can make now if that the numbers are not in the right direction, or they know that they might be predisposed to coronary disease.
When I was younger, when I was a kid, my parents, we had meat 6 nights a week. One night we had dairy, and we said, "What, again?" Today it's the reverse. You should have meat maybe 2-3 times a month.
And with meat, we're talking red meat?
Beef, lamb, and pork.
Okay. What about chicken?
Now, I recommend, and it is recommended, chicken, fish, and turkey, or turkey, chicken, and fish. Yeah, that's right. That's what you should be eating. And you reduce, you shouldn't have ice cream in your house, because you're going to eat it and it's going to make you bigger, and it's high in fat because it's cream. Okay? So, and also stay away from those fancy desserts if you can. Everything in moderation, but you need to stay away from processed foods. They're not healthy. And you stay away from meats, beef, lamb, and pork if you can. Watch the saturated fats in your diet, and that'll make a big difference in your cholesterol profile, because we shouldn't be eating like that. None of us.
So what is it, besides the chicken and
chicken,
the
fish, and turkey is pretty good.
Vegetables?
Yeah, vegetables are always
leafy
good.
Greens?
Yeah. And if you're looking to lose weight, try to reduce the carbohydrates.
Is that what you did? Because you look fantastic.
Thank you very much.
30 years younger and thinner.
Thank you very much. I hope you got that all on tape.
Yeah, I'm going to tell your wife, right?
So that's right. So not this much rice, but this much rice. Not this much potatoes, this much potatoes. Smaller portions. Eat more protein. Especially as you get more mature, you should be eating more protein, because you lose protein as you get more mature. And so you want to maintain muscle mass. So be sure to eat more protein. Watch the fats in your diet, of course. And after dinner, don't go to the TV room and start munching down on nuts, okay? Especially peanuts. I love peanuts, but they're not good for me. I know.
Too.
There's too much fat for the amount of protein.
It's like this much in your hand, and like I just need the whole container, and it's probably Costco size. I mean, it's horrible. It's really horrible.
I know, all those good things.
Yeah.
Yeah, too fattening, too much saturated fat.
And what about exercise? Let's talk about that, because you off camera we were talking about that you exercise a couple of times a week, as do I. And is that really helping us fend off or helping?
Yes, in many ways. First, it improves insulin resistance so that it prevents you from going on to glucose intolerance, preventing you from developing diabetes. It helps to lower your blood pressure. It helps you to lose a few pounds if you can. Remember, you cannot exercise yourself to skinny. The way to lose weight is you push away from the table. That's the exercise you need to do. But exercise will help. But if you exercise for an hour, you could be in deficit of 500 calories. Yeah, but you eat one cookie, it's 500 calories. So it's a combination of exercise helps the metabolism, and diet, of course, is the most important. But exercise, you want to have a balanced exercise program. Yes, you want some cardio. But if you tell me, oh, I walk every day, I walk a mile. No, you strut and stroll a mile. That's not exercise as well as it would be if you exercise where if you walk so that you could almost not hold a conversation. You may as well get some cardio out of it. But also keep in mind, if you walk every day for your exercise, one type of exercise, your body becomes very efficient at oxygen consumption for that exercise. So you need to balance it with some weight training, okay? Calisthenics. All those exercises we learned in high school that we hated, now's the time to do them.
And especially had to wear those little outfits too. They were not very pleasing to the eye. Well, at least not for me. I wasn't so comfortable. And how long does this exercise have to go on for?
Well, if you did 90 minutes a week, boy, would that be a change. 30 minutes 3 times a week. There's a quantum leap to go from 2 times a week to 3 times a week. 3 to 4, not so much. 4 to 5, not so much. But 2 to 3 times a week is a quantum leap. And that makes a big difference in your metabolism. And your body respects it. And it does have the benefit of reducing aging. I mean, I have some patients who are 75 years old, can't get up on the exam table because their legs are too weak. Because they haven't exercised. They've been sitting most of their lives, not doing anything. You got to take care of your body. It's the only one you got.
Absolutely. And you talked about the plaque, and I know that can you explain, because I know you do this, is HeartFlow, FFR, and the plaque analysis that you do at my cardiologist now?
Okay, so the CT angiogram machine will see inside the arteries without us going inside the arteries, just a regular CAT scan. But sometimes there's a lot of plaque buildup, and we want to know, does that plaque buildup compromise blood flow? So we have a way now to measure the pressure gradient or the drop of pressure gradient across that blockage to see if it's clinically significant. Because you need a 70% blockage to compromise blood flow. So in
other words, you can live and sustain up until that point?
Yes, without compromised blood flow.
But would you feel it? Would you feel any different?
No, you don't have very many. You don't have symptoms really when it's less than 70% blockage. But when you start having a pressure gradient across that fractional flow reserve, that's what FFR stands for, then it becomes clinically significant. Now, of course, there's also small vessel disease, which are not the big arteries. They're the ones downstream. But they're small and control only a small area. Can they give you symptoms? Yes. Coronary spasm can give you symptoms. And those are considered too. But they're not so much causing heart attacks as obstructive coronary disease.
What does that mean, a spasm? Your heart flutters a bit?
No, the arteries themselves go into spasm. And we do have a number of patients who have severe chest pain under stress. And sometimes it's a spasm of the esophagus, and sometimes a spasm of the coronary arteries, not obstructive coronary disease. We want to find out obstructive coronary disease. Now, coronary spasm and esophageal spasm are also easily treated as well. Okay, but fixed obstructive coronary disease needs to be addressed.
And we're seeing a lot of AFib and people getting out to not a good sinus rhythm. And I know that you handle that in my cardiologist's office. Talk a little bit about that, and because I'm hearing
Atrial fibrillation
a lot of that.
is the most common arrhythmia in the United States. And what it is they have the upper chambers, lub, and the bottom chambers, dub. Lub, dub. And so the upper chambers,
It sounds like a musical, lub and dub.
they start to fibrillate. And when they fibrillate, they don't contribute to the cardiac output. Very common. Okay, now what's the problem with that? Well, you could be a little more sluggish, but not necessarily, because the big dub part kicks in and takes over for that. But the problem is there's sometimes blood clots that form in these little chamber, the little atrial chamber up on top, and those blood clots can sneak around and go up into the brain and cause a stroke. That's why we put patients on blood thinners who have atrial fibrillation. And that's really the major worry. But once you're on blood thinners, your risk of stroke is the same. Now, for years and years and years, maybe millions of years, we've had atrial fibrillation. And 20, 30 years ago, we called them chronic fibbers. People who were in atrial
fibrillation. They lie.
People who are in atrial fibrillation all the time. Man, they lived regular lives. It wasn't that big a deal. We controlled the rate and didn't go up very much. But today we have new techniques. We know that if we can convert you back to regular rhythm, you'll live a little bit longer. The heart will be stronger, and you won't be bothered, and you won't have to take blood thinners. Because when you get to be 80 years plus, if you fall down and hit your head or hit your head on a cabinet and you're on a blood thinner, you're going to bleed. And you don't want to bleed in your brain because that could be fatal. So today we have what's called atrial fibrillation ablations, where they go up in through the groin, up to where the heart is. Why don't you watch it on TV? It takes about an hour, hour and a half. They find the area that's causing the atrial fibrillation. They cauterize it or burn it, one or the other, okay? Or freeze it. And at the same time, we can put in what's called a Watchman procedure, which is a little plug that you put in the little appendix. The left atrium has a little appendix where 95% of all the clots are formed. And if you put that plug in there, 95% of all the clots are there, then we can get you off blood thinners, even when you have atrial fibrillation. And it's a combination procedure because you're right there. Plug, atrial fibrillation ablation, it's a no-brainer.
Let's talk a little bit about what is the biggest benefit of being seen at the clinic versus waiting weeks, which we talked about at the beginning of our interview for an appointment. What could go wrong?
Well, the problem is that sometimes patients ignore their symptoms. And time is tissue, as they say, because you could be whittling away at your muscle mass in your heart, even though you haven't had a major heart attack, but you're slowly chipping away at it. or the blockage is building up to a point where it'll eventually close, and then you'll end up with that heart attack. We'd like to get there before that happens. I can't tell you how many times we've found patients who come in for preoperative clearance. You know, the surgeon said, "Oh, you're going to do your knee? Come on, go get a cardiology clearance." And we find out they have 3-vessel coronary artery disease. And fortunately, we're able to fix that before they go for their surgery. But that's because they came in for a cardiology clearance. We'd like people to be a little more proactive in that.
And how often should one get to a cardiologist?
Well,
to come see you and your team?
Our team. It depends on the symptoms. You're having symptoms, or you're having blood pressure that's not controlled, or your cholesterol doesn't seem to be controlled, or you have atrial fibrillation or palpitations that you don't know. Is this atrial fibrillation or not? Because you got to know. Because if you have palpitations you don't know, you can end up with a stroke. You don't want that. Okay? So, and if you're not having symptoms, I think an initial evaluation by a cardiologist to see what your status is. We want to know what your risks are. We have a procedure called a coronary calcium score. And a coronary calcium score, and we do it right there at this facility. It's a mini CAT scan, the equivalent radiation of only 2 chest x-rays, no injections, no nothing. It's just like a chest x-ray. And we can see any plaques that are in the 3 coronary arteries, because plaques are made up of calcium and the crud. and the calcium crud and the cholesterol crud. Okay, so we can count up the calcium deposits and know what your risk is. If you have a lot of plaques, then yes, you have a greater risk of having problems in the future. Or you have no plaques, and that's very reassuring.
Does it change? Do you have to go do that again and again and again?
Well, we usually check them once every 5 years, okay? Because we'd like to know if you had a calcium score of, let's say, 200. Okay, so 0 to 100 is low risk, 100 to 300 is moderate risk, and over 300 is significant. So let's say you're at 200, and then 5 years later now you're in 800. Your cholesterol wasn't controlled because you've had too much buildup. So you need to be more aggressive in controlling that cholesterol and controlling the diabetes and controlling the blood pressure.
And how is that controlled?
The blood pressure?
Yeah, how do we control the calcium score to help it? Can
so-
you lower the calcium score?
So the calcium score doesn't lower because those are fixed calcium deposits. So they usually stay. But we just don't want them to progress, okay? Because we worry about the calcium deposits and the plaques rupturing and then blocking the artery. Okay, so we lower the cholesterol with medications and diet. We lower the blood pressure with stress control, dietary control. Some people take beets, but you got to eat those every day.
Beets?
Beets, that's a big fad now. But that's okay. As long as we get to goal and control your blood pressure, everybody's
What do
happy.
beets do?
Well, they have certain chemicals in there that help to lower blood pressure.
Well, I'm going to go right after this, go to Whole Foods.
But then you got to check your blood pressure afterwards and see if you got to goal.
Yes.
Okay, so the cholesterol, the blood pressure, and of course your sugar. You want to be sure that you're not eating too many sweets. Okay, yeah, I mean, sweets are good, but you don't have to overdo it. Okay.
My cardiologist now. It's so valuable to have everything in one facility. Talk about that for a patient and peace of mind.
Yes, in one facility. So sometimes you'll go to your primary and you say, oh, go over there and get an echocardiogram and go to that facility and get a CT angiogram and go to. That's too much running around and it's not coordinated. A cardiologist can coordinate it, but most cardiologists don't have all those ways to evaluate you in their office in one location. This is all in one location. You'll know by the end of the day what you have and what you don't have. So it's one-stop shopping, so to speak, instead of running around everywhere. And also, most importantly, keeps you out of the emergency room because the emergency room could be very expensive, especially if it's
time and money.
Time and money.
So in the couple of seconds that we have left, anything that we haven't covered that you want to share with our audience about My Cardiologist Now, heart health?
This is now, I think, going to be the wave of the future because patients don't want to be mistreated anymore. They want to have care when they need it. And I'm imploring patients not to ignore their symptoms. So if they don't ignore their symptoms, don't ignore their clues, and seek medical attention, and everybody should see a cardiologist at some time in their life, and putting it off never helps you.
Absolutely. And I want to thank you, Dr. Cimoli, for all of the information for our audience, because it can go on for days. We can talk about the heart, whether you with love or with disease. We don't want that to happen to our community. And My Cardiologist Now is here for you. Just give them a visit. And they are located in the Greenery Mall in East Kendall. And I want to thank you for being here with me.
Well, thank you very much.
And I want to thank you for joining me.